what exactly is pain, what exactly is the anatomy. And then in the coming sessions, in the further sessions, we'll be discussing the physiology of pain, the pathways, and so on. So we'll be proceeding from the, step by step. We'll not be discussing some very hi-fi topics in the very beginning. And then, so that you will have a basic understanding what exactly is pain, how exactly is the origin, what exactly is the mechanism, what exactly is the phenomena, and then you can easily correlate with all the diseases and you can also correlate in your clinical practice. So let us start today's session talking about the background. Yes, the pain word is a Latin word and it has been derived from a Latin word, pione, and the Greek word poen, meaning penalty or punishment. So it has a Greek and Latin origin and defined according to the International Association for the Study of Pain. They have defined pain as an unpleasant sensory emotional experience associated with actual or potential tissue damage, or described in terms of something which has caused damage. Or the second definition can be it is an unpleasant subjective experience, which is something you experience. It is a subjective phenomena that is the net effect of a complex interaction of the ascending and descending nervous systems. So there is an ascending pathway, there is a descending pathway, which we'll be discussing the pathway of pain. So exactly it all evolves and revolves around that pathway. So the pathway has some biochemical, physiological, psychological, and neocortical process which is going right from the point of contact or from the point of injury or any inflammation which has occurred till the point of your subjective experience, till the time you feel the pain. Some another background talking about, so Aristotle has described pain again a feeling and classified it as a passion of the soul where the heart was the source or the processing center of pain. So this was something, a philosophical psychological kind of definition which was given by the Aristotle. And again Galen, Vesalius, some other philosophers postulated that pain was a sensation in which your brain played an important role. Yes, so we know that brain is the transformer of the body, so it definitely plays an important role. So again, there was in 19th century, some other philosophers came, Mueller, Van Frey, Goldscher, hypothesized the concept of neuroreceptors, nociceptors, and sensory input. So again, over a period of time, this pain has seen changes in its definition, in its concept of, evolving. So looking at about some of the data which has been given by the American Pain Foundation, you see that more than 50 million people in US suffer from chronic pain. So there is a chunk of population not only in the US, talking about India and talking about the whole world, or maybe if you see in day-to-day life, every second or the third person is suffering from some or the other kind of pain. People who are working in the office from 9 to 7, 9 to 6, and they started having backache, they're having stress, headache. A lot of people are suffering pain. So an additional 25%, 20 million experience acute from injury, or they've gone any recent surgery. The National Institute for Occupational Safety and Health estimated that the cost of low back pain alone was between 50 billions to 100 billions per year. So you see that how much amount of money either is being generated or is being spent on just at the treatment of low back pain, because of that sitting habit, because of that posture, long sitting hours, what kind of chair you are using. So this number is way too big to think about. Now again, some standard definitions given by IASP: an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So these are the most common definitions which you either maybe prepare or maybe asked in your viva or in your some one liners or so. So these are the standard definitions which you often come across of pain. So unpleasant emotional experience usually initiated by a noxious stimuli and transmitted over, again there is a neural network which processes and transfers to the central nervous system, where there is an interpretation, and then that interpretation you see it as a pain phenomenon. Now talking about the characteristics of pain, it has 4 or 5 important characteristics. The first one is threshold and intensity. So if the intensity of the stimuli which is causing pain is below the threshold, that is known as sub-threshold level, that is something below the level, that pain is not felt. That threshold has to reach to generate that action potential. That is very important. So as the intensity increases more and more, you feel it according to the Weber-Fechner's law. So anyone in the audience, what exactly is Weber-Fechner's law? Exactly, it is a physics definition. But if you know about the Weber-Fechner's law, it is correlated with some of the other kind of stimuli which you often come across. So it exactly say that just noticeable difference between the two stimuli is proportional to the magnitude of stimulus, or in simpler terms, if I elaborate it, the stronger the stimuli, the bigger the change you need it to notice it, to feel it. So that exactly is the, this law ensures that while our body perceive pain due to low intensity, a severe crushing injury will not cause death due to pain sensation. Yet as stimulus increases, sense of perception increases. So that exactly is the, Weber's Fechner's law, and that exactly correlates with it. Now, the second characteristics is adaptation. Pain receptors, there are a lot of pain receptors. They show no adaptation, and so the pain continues as long as the receptor continues to be stimulated. So that adaptation has to be reached until and unless you didn't feel pain. Otherwise, you kept on feeling pain. Localization. Pain session is somewhat, poorly localized. However, superficial pain, we'll be talking about in the further slides, what exactly is a superficial pain, what exactly is a deep pain. So superficial pain is comparatively better localized when talking in terms of deeper pain. Now, talking about the fourth characteristics, influence on the rate of damage and intensity of pain. So if the rate of tissue injury is high, it is very common, the intensity of the pain will also be high. Now, this is again a important flow chart or diagram which I want you to understand it. That starting from the somatosensory system. So this is the main system which is responsible for detecting, processing, and processing of sensations like touch, temperature, and pain. So you see that you have brain, spinal cord, and peripheral nervous systems. So brain is the place where the processions and interpretation of signals take place. Okay. And what exactly is the role of spinal cord then? So it acts as a relay station, some kind of a relay station where pain signals, the signals ascending and descending pathways, they are modulated before going to the brain. So it acts as a relay transmitter kind of thing. And the peripheral nervous system is the first site where exactly is where the sensory input like pain, touch is detected. So again, in the brain, you have somatosensory cortex, you have thalamus. So thalamus acts as a relay station which directs sensory info to appropriate brain regions. And somatosensory cortex is the final site where the pain is consciously perceived and localized. So this has to be, very clear what exactly is the phenomena which is going on. Now, spinal cord has dorsal horn and ventral root. So dorsal horn is the entry point for sensory pain fibers. We'll be seeing in the further slides, then exactly, you'll have a clear understanding where exactly is the entry point. And ventral root is mainly the motor output, where exactly, it acts as a part of relay. Now, talking about peripheral nervous system, you see you have a efferent neuron, you have a efferent neuron. So efferent neuron, something, this carry pain signals from the tissues to the spinal cord. Efferent, the role of efferent, that is AFF. Now, when talking about EFF, that is efferent neuron, they carry motor response from the spinal cord to the body. So you have to understand this, that efferent from tissues to spinal cord and efferent is from spinal cord to the body. Now they have two fibers, that is A delta and C fibers. So A delta are fast fibers. They are myelinated fibers, and myelin sheath has that node of Ranvier through which that saltatory conduction of electrochemical impulse is generated, or where exactly is the transmission of. So it process and it makes the impulse transmission fast because it has a myelin sheath. When talking about C fibers, it is unmyelinated. So again, if it is unmyelinated, if it will not have a myelin sheath, if you look at the anatomy of the nervous system, so any unmyelinated, it will be a slow. The transmission will be slow, and there exactly the pain which you will feel will be a slow or a dull kind of pain.